For this edition of the U21 Health Challenge, we present the prevention of vector-borne diseases, a multidisciplinary approach. Vectors are organisms that can transmit infectious pathogens between humans or from animals to humans. The World Health Organization identifies major global vector-borne diseases, such as malaria, dengue, yellow fever, Zika virus, lymphatic filariasis, Chagas disease, Japanese encephalitis, among others. Vector-borne diseases account for more than 17% of all infectious diseases and causes over 700,000 deaths annually. Warming and other manifestations of climate change, including changes in precipitations, flooding, and drought in some other areas, have important implications for vector-borne diseases. Many vectors are already expanding their latitude and altitude ranges, and the length of season during which they are active is increasing. These trends are expected to continue as the climate continues to warm.
Taking this into account, it is important to note that the dynamics between vector and people play a significant role in the outcome of diseases transmitted through vectors. As such, non-healthcare people need to be recognized as active actors because they participate in vector control every day. They can create environments that may decrease or increase vector-borne diseases. As such, we suggest the use of mass media campaigns such as radio, television, newspapers, and of course social media to promote awareness on the topic. Lastly, educating them about the diseases that may arise in their territories due to climate change is essential for vector control and can ultimately be used as a disease prevention strategy.
Adapting the healthcare system to deal with the crisis. Having healthcare professionals trained to deal with vector-borne diseases and recognize its early symptoms. Training of climate-educated health professionals to address the domestic and worldwide shortage of health professionals. Creating climate-resilient healthcare systems, and aiming for universal healthcare access, especially in vulnerable regions. Investing in accurate diagnostic methods in order to make them widely available for climate-sensitive vector-borne diseases, and also investing in the development of safe, effective, and affordable vaccines.
By creating new collaborations or strengthening existing partnerships between agricultural and public health sectors worldwide, we will be able to identify potential basins for vector-borne diseases like irrigation channels and determine insecticides that may have resistance in vector populations. We can also put in place reporting mechanisms to facilitate early detection when these diseases arise and assist public health vector control efforts. Successfully addressing the challenges that agriculture poses to vector control requires an intersectoral approach between public health and agricultural sectors towards disease-reducing interventions.
It is well known many governments may see preventive measures as a waste of resources, but in these changing times where climate change has a greater and greater impact, that is fundamental to mention the importance of preventive measures. Why be reactive when you can be proactive? It is fundamental for the collaboration to exist between who and local governments with affected communities in which there's a prevalent danger for vector-borne diseases. Within this collaboration, all parties will benefit. The local communities will not only receive information about such diseases, but they will also receive preventive measures for these vector-borne diseases, which could facilitate early detection, while the WHO and local governments will be beneficiary of economic incentives. Such incentives have a vast area of impact. One example being the economic benefit that will exist with preventive health measures over the cost of treatment for a pathology. Nevertheless, the greatest economic incentive is the prevention of another outbreak, such as seen with H1N1, dengue, which in its peak resulted in an overrun and expensive public and private healthcare system. Infectious diseases events in today's globalized world will require nothing less than such robust institution community partnerships and responsibility for optimal healthcare and economic security. With this last proposal, we suggest investigation and possible implementation of new technologies that could change how we fight vector-borne diseases. In this case, being genetically modified mosquitoes, which is a direct result of revolutionary advances in biotechnology. These genetically modified mosquitoes could be modified with pathogen-blocking bouwaki bacteria, or can be genetically sterilized, to name a few possible genetic modifications available to us. Such modifications will allow us to control and reduce vector-borne diseases, since it will disrupt the viral transmission cycles and reduce the possible vector population.
All in all, mosquito control has become increasingly inefficient on a global scale. Therefore, it is crucial to apply a comprehensive and inclusive approach and to have an efficient collaboration and coordination between various sectors of the healthcare and non-healthcare community, as this is a responsibility that everyone in society shares.